Hey everybody, welcome to the Meddkit channel. We're really excited to have you here. And today we have the coolest woman ever. Her name is Joyce. She is the operations manager of Creative Health and Spine. And you're going to have to forgive me because she is so decorated. I'm going to have to read her intro. And she has been in the industry since 2007. She is a mom of 5 and a grandmom to 2 little ones. She is also certified in medical billing and coding. She's a certified nurse assistant, and in 2015, she also went back to school and she finished her associate's degree in mathematics and natural sciences. So welcome, Joyce, the
Thank
magical
you.
woman.
Thank you so much.
Yes, thanks for joining us today. We're super excited to have you, and we know that you have a lot to say. You run a tight ship over there, and so we want to get started and ask you a few questions. So how did you get started in the practice? Tell us about Creative Health and Spine.
Well, I was looking for a good fit. I had run my own business for a long time, and I had enriched chiropractic offices and helped their staff learn how to do billing, learn how to talk about the science and run a chiropractic practice and everything that goes with chiropractic. I wanted a home. And so I was looking for a home. And, of course, Indeed is a wonderful thing. And I had sent my resume out and I said to the doctor, when we came in the interview, I said, well, if I like you, you can keep me. And so he did, and I kept him. I love to say that I kept him. I found a home. I found a great fit here.
Oh, that's so awesome. So tell us what is unique about the practice.
Well, at Creative Health and Spine, we have an integrative practice. We treat the entire body, and we treat the body as a whole. We have an educated staff that consists of 2 board-certified chiropractors, 2 licensed massage therapists. We have a personal trainer with her degree in exercise science, a formerly trained chiropractic assistant, a certified medical billing coding representative, and a seasoned receptionist. So our chiropractors here, they perform testing and consultations to holistically treat nerve and disc disorders, neuropathy, weight loss, thyroid, and other metabolic issues, along with the patients that seek standard chiropractic care.
That is amazing. That is a handful. You guys do a lot. That's truly amazing. So tell us, for you, what is the most rewarding but also challenging aspect about running a private practice?
Well, I love starting things with, I want to end it on positive. So challenging. Challenging a lot of times, being a single mom of 5, balancing life at home and the demands of our patients and our staff. There's a lot of times I find myself scheduling appointments, screening patients at the dinner table, or even just cooking meals for my family. But there's the rewards, and my kids, I love to be the example to my children and to their friends. So even when they've got friends over and they're all sitting at the dinner table, your mom works so hard. Well, she loves what she does. And that's part of the rewards. I think the most rewarding aspect is seeing people get better. Watching people crawl in and seeing people walk out is just such a wonderful thing.
That is amazing. And your staff seems incredibly talented. And you were showing us before this the thank you note that they wrote
Yes.
you and everything like that. Which I'll go into COVID a little bit early, and we'll keep it more positive in the end. So
Yes.
tell us how you guys were affected by COVID-19 and what happened there.
Well, it hit everybody kind of like a freight train, especially us in the operations field. One minute we were rocking and rolling. We're seeing patients, we're scheduling appointments. There's no screening. There's none of this, and it was pretty amazing. On March 12th, we had learned about the local school district here in Berwyn, which is T&E, Tredyffin Easttown School District, was shut down on March 12th. So it was shut down right after Montgomery County had shut down, because we are probably about 15 minutes away from the epicenter here in Pennsylvania. So we knew right away that we were going to have to make some drastic implementations, being that close to the epicenter, being that centrally located to people who live in Montgomery County and work here in Chester County. or even Delaware County and work up in Montgomery. We can't stop here along the way. We're a straight shot for all that entire area. So we have a lot of patients from Montgomery County. It really was amazing. On March 9th, we had over 25 patients on the book. We were rocking and rolling, and then the next week we only had 10. So, yeah, a week later, 10 patients. I had said to my boss in all my years of doing this since 2007, I never seen that much red for cancellations on the computer screen for a scheduling date.
That's crazy. So what are you guys doing in the office now to keep things safe, or really are safe? You tell me.
We, first and foremost, and most importantly, we are pleased to announce that our policies here have helped keep our staff. We can confirm that none of our staff members or our patients treating here in the facility have had a positive COVID testing. We've had a couple of scares, but that was something that we are required. We had one of our staff members who said she had felt sick. She had a fever. She went home that day. I made the appointment for her to get tested, and her test came out negative, which was great. And we were so happy to have that, that result back. But we implemented antiviral. We had antiviral air purifiers brought into the facility. Yeah. We are very fortunate that we have a facility with windows, so we opened up all the windows in the facility. We were gloved, we were masked, we became superheroes with masks on and gloves on in the rooms with the patients. We had to make sure that our staff, was continuously washing their hands. Our patients arrived to the building masked, they washed their hands before they treat. They're screened over the telephone for COVID. So we brought a lot in here, and it's all OSHA requirements. We can't operate unless we have our employees protected. We provide masks to them, and we can't operate unless our patients coming through the door, per CDC regulations and Pennsylvania Department of Health regulations, we can't operate unless we follow these guidelines. So.
Oh, that's amazing. And I know everyone from staff and clients appreciate it, truly.
Yes, and that's what's most important is keeping people safe. We have a very talented staff, and that was one of my biggest concerns is what are we going to do to keep our staff members safe?
Well, I know they appreciate it because I saw that very nice long note. Why don't you show it, Joyce?
I will.
Why don't you pull it off the wall?
So during the
that's so nice.
See if I could get this up here where you can read it. Yep.
Everyone loves Joyce.
It's amazing. They brought me this thank you, and it was very touching. It really was. It was about the first month after COVID that had come in, and that was good to see that we were appreciated because I really did work hard to keep these guys safe.
I know you did. So backtracking a little bit, how do you think healthcare has changed since you first entered the field? We know we've seen a lot with COVID, but what else? What else?
Well, boy, back when I first started in 2007, we were using ICD-9 diagnosis coding systems, sending paper claims to insurance payers. And, after a few years of this, the EHR initiative just took off. It was then a regulation that we had to implement these policies. We had to do electronic health records. I'm sorry, my phone was ringing in the back.
You're a busy lady.
Sorry about that, everything. But every quarter, there's some things that are changed with CMS, which is Centers of Medicaid and Medicare. So with that being said, different practices, we just have to stay on top of it. So it's not just changes since 2007. There's been changes since February. So
yes. So if there's anything that you could change about the United States healthcare system, what do you think it would be?
Oh boy, everything. Well, a lot, everything. To quite honestly tell you the truth, I love having the Obamacare. It's not out the right way. Quite honestly, everybody's deductibles skyrocketed to $5,000. There's no such thing as a free lunch. Let's face it. And I think that is what the government gave this false impression of. I know even when Obamacare came out, I got free insurance for a year. I was like, wait, what? I don't have to pay for this for a year? And then all of a sudden I had to pay for it. I was like, wait, why did this happen? What I would love to see happen is for people to have less of an out-of-pocket cost for their care and more care. We need more care. We are in a broken healthcare system. We have a healthcare system that is pushing medications on patients, and these medications cause so many different side effects. Then these patients have to treat their side effects. So you have this cycle that's happening in our broken healthcare system. And one thing I love about chiropractic is that we try not to be a part of that. I come up with wellness policies. So if I have a patient with a $5,000 or $6,000 deductible that they're never going to meet because they're a young patient, they don't need that much care, I make sure I put in a wellness package. And it would be really nice if there was insurance policies that catered more. Instead of me being a 45-year-old woman, my insurance now is a lot higher than somebody who's 21. Whether I smoke or not, or that, you know what I mean? It doesn't matter. So it would be nice if we could make it more of a universal system. Unfortunately, we're not going to be able to do that as long as it's kept in the business aspect. It's right now it's a business, and it doesn't seem like healthcare to me.
So on a positive note, what do you think the future of your practice looks like?
Well, here, let me see if I can get to where we're at here. It is difficult to say at this time. I mean, we've begun to see the community emerge from quarantine and come back into the office. However, we still have a decline in patients that we had from this time last year. Basically, we are playing it by ear just like everybody else. We're waiting to see what happens in September. In September, if the schools are closed, we don't know yet, and that's the thing. And if the schools are closed, it's going to affect our patients because, again, we can't have any guests. So if the patient has 3 kids that are homeschooling and they're at home, they can't leave those young children at home, or in the parking lot in the car, which we totally don't want that either. And we love having kids in the facility. We love seeing the children come in, but it limits us. So it's a little touch and go right now. We're waiting to see what happens, just like everyone else.
Yeah, I hope the best decision is made, but also that you guys can get back to more what you can do to help more people. So, but we appreciate it. We appreciate all your time today. We loved interviewing you. And we hope to see you next time. Thanks again, Joyce. Miss Wonder Woman.
Thank you for having me. Yes, thank you so much for having me. I appreciate it.
Anytime, Joyce. Have a great day.
You too.